Thank you so much. Assalamu alaikum, peace be upon you, to all who have joined us for this important conversation. I'm going to get right to it. After racial data for COVID-19 patients in many states became available, it became clear that the pandemic is disproportionately impacting Black communities all across the US, including and especially Black Muslims. Now, as many of you might know, Black Muslims make up between a quarter and a third of all American Muslims. We're very honored to have an expert panel today to help us understand the impact of COVID-19 on the Black Muslim community. Thank you for joining us. This webinar is put together in partnership with the National Black Muslim COVID Coalition, represented by our panel of experts today. So I'm going to go ahead and start with you, Marguerite. You're a co-founder and a program director at Muslim Arc. You're an anti-racism educator and expert. Help our audience understand what makes Black communities in general more vulnerable to the impact of COVID-19.
Yeah, so we founded Muslim Anti-Racism Collaborative to address both interpersonal racism and systemic racism. And one of the key aspects of how racism shows up in America in particular, that's where we focus on, is in health disparities. So the health disparities that impact Black populations, like those are being exacerbated during the pandemic. And since, you know, one of the things that is really significant, like when we first started the Black Muslim COVID Coalition, we started it before we knew, before we knew the statistics, because we knew that when America gets a cold, Black people get the flu. And people have used that to talk about economic situations, but since even during the antebellum period, whenever there was illness, that whether that was cholera, smallpox, tuberculosis, that it impacts Black communities even more. And it's really important to challenge the cultural racism that tries to explain those health disparities, because those have also existed for centuries. But what we do know is that inequities in the health system, lack of access, that is a key indicator, like that's a key factor. We also have to address not just the lack of access, but some of the bias that goes into diagnosis when people are turned away, the care and treatment. And then there's other factors that impact, that leave Black communities vulnerable for health issues, and that includes access to food. So we have food deserts where people are also, because of high stress, racism is very stressful, and there's a lot of studies that have shown just the impact of both the interpersonal racism, but also the structural barriers, and just the levels of stress add to hypertension, with diabetes, and that's not just lifestyle, like there are things that are genetic, but there's also environmental, and systemic factors that lead to people being more susceptible to that. We also have populations that, like we have a high concentration of Muslims in the prison system, and they're impacted. And so, first line people who are, when we're talking about outside of the medical profession, even though we do have a high number of nurses. I lived in Philadelphia, and you would see lots of niqabi nurses, and I'm concerned about their well-being too. But we have a lot of people who they're still working. They're working in stores, they're doing delivery. So when we think about people who are likely to be exposed, like many of the displaced populations, there's large concentrations of Somali workers who are being exposed to COVID in factories, because the factories weren't either shutting down or letting them take time off. So, overall, what you have is like a perfect storm that has led to just really both disproportionate infection rates of people who, despite whether having high vegetable in their diet, they're not doing, like, all the tropes that we've seen that replay, they're not, they're still impacted, and they're still getting infected. and suffering more. I would say the other aspect is like the environmental racism that's not really talked about as much when we think about the impact of factories where with redlining, where Black communities, where people were allowed to live. And, you know, even in the area where I live in San Bernardino County, high pollution rates because of the trucks and the warehouses. And so, which has that, this area has a high concentration of African Americans and where they tend to live. And that leads to asthmatic conditions, which make people extremely vulnerable and more likely to have higher mortality rates.
Thank you so much, Margaret. You mentioned some tropes about that try to explain why this impact is so disproportionate among Black Americans. Can you dispel some of those tropes? Can you maybe tell us what the most popular ones are, the most prevalent, and tell us why they're false?
Yeah. Well, one I heard, and it may seem well-meaning, but it was deeply harmful. It's, you know, like blaming, you know, like if we want to blame culture, make this about a personal choice. And so that's like, you know, when people say like, don't take that extra serving of food so you can avoid the diabetes. And that's not how it works, right? Like that's not, you know, like, especially now, I mean, when we're talking about like some of our elders who are more vulnerable, and if they went on a diet yesterday, like that would not impact the health outcomes. So, you know, that particular trope, or the idea that the African American community are partying more than Americans, you know, more than anybody else. Well, America has a higher infection rate and mortality rate, and Americans have a higher higher obesity rate globally than anybody globally, but yet no one's blaming American culture for our high mortality. But those arguments are definitely pointed towards the Black community. So even when we have the Surgeon General asking people to not party and not drink and not smoke, and you're just like, well, the people that I know that are getting it don't do any of those things. And so, you know, they weren't blaming the broader culture for Florida, right, and the young people who were out there. But you do have those explanations where people may take an anecdotal story, right, where they may have seen like gatherings and, you know, of people, and then assume that overall that that's the clearer reasoning than the structural aspects, the structural racism that still exists in this society. I think there's a few more, but it's yeah.
Those are, yeah, so those are the ones that I keep hearing about as well. Thank you so much. Kameelah, as the founder and president of Muslim Wellness Foundation, a nonprofit organization dedicated to promoting healing and emotional well-being in the American Muslim community through dialogue, education, and training, and you're also, we're proud to say, an ISPU scholar. Please talk to us about the unique challenges specifically facing Black Muslims during this pandemic, as well as the path to healing.
Assalamu alaikum, everyone. I'm really delighted to be here. I think this is an important topic that has implications for not just the Black Muslim community, but for all of our communities, and how we talk about disparities and structural inequalities which lead to these unfortunate outcomes. I would like to share my screen so I can provide some information in a very succinct way. And you know, hopefully this will help us begin to understand what we're facing. So thinking about kind of Black Muslim wellness amidst the pandemic, I am reminded of this quote from Bell Hooks, in which she says, within white supremacist capitalist culture, Black people are not supposed to be well. This culture makes wellness a white luxury. And what that means is when we think about the kinds of sort of career options or work options that Black Muslims in particular, I'll speak to, you know, this specific community, that are available, the sort of environmental racism that Margaret mentioned that plague our cities, in which you find high concentrations of Black Muslims. When you think about the disproportionate rate of our community members who are also incarcerated citizens, there are seemingly insurmountable barriers to wellness, and those are structural. And so when we think about lifestyle choice, that begins to sort of blame the individual for a structural failure, which is to protect its citizens. When we also think about what it means for us to be well, this idea of social toxicity is also very important to remember. So this is a term that's used to describe sort of the physical pollutants in the environment that sort of decrease wellness for a certain population. That could be sort of lead in the air, that's smoke, that's living close to a factory that's sort of emitting these pollutants in the air. So when we think about the social or the psychosocial pollutants in the air for Black Muslims, that includes anti-Black racism, that includes just the microaggressions that people navigate on a daily basis, both in broader American community, specifically in the African American or Black community, and also within the American Muslim community, when we're talking about, for sure, the important work of Muslim Anti-Racism Collaborative. And so that combination of social toxins, when we're thinking about racism, oppression, poverty, high rates of incarceration, and these are not sort of individual failings, right? We can't think about this as, well, why aren't Black Muslims taking responsibility for those factors and changing them? But that, as Bell Hooks said, this society was not built for us to be well, and it is designed with the goal of maintaining systems of oppression. And it's important for us to remember that as we begin to combat what's happening during the pandemic and also beyond that. This is, I think, a great representation when we talk about Black Muslim intersectionality. And I mentioned it just briefly. This means that within the African American or Black community, there's an assumption that most of the members of that community are Christian. When we think about the American Muslim community, sort of in large part due to the propaganda around Islamophobia, the collective imagination sort of thinks about American Muslims as Arab and South Asian. And so within those two things, we as Black Muslims are often invisible. I tweeted out ISPU's data around the ethnic diversity of American Muslims, and someone from the UK responded and said, I wasn't aware that 20 to 25% of American Muslims are Black. I never see them. And for me, that is very distressing, kind of given the history and the legacy of Black Muslims in this country. So this is something that, I think always bears repeating, that Islamophobia will never be the new Black. And so as Black folks broadly face structural Islamophobia, right, not simply interpersonal interactions, this doesn't sort of become the new system, but it is one in which, is built on the history of anti-Blackness in this country. Intersectional invisibility refers to this idea, again, of Black Muslims sort of not fitting the expected image of who African Americans are, and also not fitting what is expected, right, in broader society of who American Muslims are. So this is sort of my way of trying to depict this visually, that often what becomes the implicit assumption and belief is that Black does not include Muslim, and that Muslim does not include Black, such that when we have even COVID advocacy efforts, specifically with the Black community in mind, the question I always have is, are we inclusive of the religious and ethnic diversity of the community? So if we're talking about food distribution, does that include non-pork options? When we're talking about access to healthcare, are we also advocating on behalf of perhaps undocumented, Muslim African citizens in this country? And so we have to begin to kind of broaden our ideas, because they have dangerous implications for us as Black Muslims, both physically and emotionally. So this often looks like, or sounds like, statements that were made by young Black Muslims that I've interviewed, that when I walk into a room, people have expectations like, oh, she's the oppressed Muslim woman, or she's a dumb Black girl. Again, kind of playing into those tropes. This is from a young man who said that, you know, when I have interactions even with Muslims, I'm viewed in such a racially derogatory and stigmatized way that I don't find safety in places that I would expected in my faith community. But then we also have, you know, many of us who feel this way, right? Being Black and Muslim, it means everything to me. And so just to kind of summarize what I've presented here, that Black Muslim intersectional invisibility has implications for our mental and emotional health, because that is a pollutant, that is a toxicity that we're navigating in the midst of just rising and alarming rates of infection and death related to the COVID pandemic. So on thinking about the anxiety and the despair that people are feeling about the possibility of falling ill or dying, combined with the racial trauma and violence that's being experienced in this moment, combined with calls by the president to ban immigration, to talk disparagingly about Muslims, combined with the structural racism that has been present for centuries. So this is the sort of environment in which we're advocating for specific attention to be paid to Black Muslims in this moment.
Thank you so much, Kameelah. I think you laid out a really important survey of all the different factors that impact people's lives. And it's a perfect segue into speaking to Imam Tariq El-Amin, who's a community and religious leader working in the grassroots. And to you, I wanted to ask this: what are you seeing as the biggest challenges facing families in Chicago, specifically taking into account that this is one of the epicenters of the crisis? One statistic I read that just shocked me, honestly, was the idea that 70% of COVID deaths have been Black people in Chicago, when they only make up about 29% of the city's population.
Yeah. Assalamu alaikum. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala Rasulullah. I'm honored to be a part of this conversation, and I think that's a great point to begin with, to really illustrate that disparity. In addition to being just under 30% of the population in Chicago, we're also 52% of the cases, of the COVID cases, on top of leading to 72% of the fatalities that result from this. What we have really seen, and painting with a kind of a broad brush, is that as our faith has been one, as African-American Muslims, Black Muslims, there's this tradition of our faith being the bedrock for our civic engagement. We have used our faith as a way to respond to the injustices and the inequities that are present in society. And one of the challenges that we have seen is that there's a challenge of acceptance. And that acceptance lies in, first off, realizing that, we often see ourselves and we try to operate as custodians of the communities that we are in, right? So we have a long history of stewardship. And that stewardship, in some instances, it has been related to fulfilling the needs of the moment, the basic needs, food, clothing, and shelter. And those are admirable, and they are needed things. And, these are things that, inshallah, we can try to continue to do. But I think the challenge here is accepting that that is actually not enough, because what we realize now is that we are witnessing the breakdown, or maybe not the breakdown, but the illumination of the intended system. As it was brought up, how Bell Hooks mentioned that Black health is not an intended outcome of the system. So the triage approach that we have taken from a faith institution basis, not just necessarily just as Muslims, but just faith in general throughout the Black community, has been one more often than not of triage, where we are just serving the needs of the moment. And this is pushing us to a point now where we see these inequities that are front and center, right? 30% of the population here. And I believe I saw someone, if you can look at Milwaukee, their numbers, I think they're 80% of the fatalities there. St. Louis, tremendously high numbers, Michigan, right? So these numbers continue to replicate themselves, and these are showing us that there's a system in place that is now allowing us to see that our efforts, although well-intended, they're not enough. So here we're forced to kind of look at ourselves and say, well, how are we going to affect systemic change? How are we going to affect structural change? How are we going to change our institutional cultures? One thing I do want to point out for the Black Muslim community, for African American Muslims, is that this instance, as was mentioned before, you know, if white America has the cold, Black America has the flu. On a masjid level, and once again, I'm painting with a broad brush. A lot of folks aren't aware of the institutional culture of the differences between an African American masajid and say, you know, an Arab, South Asian, or other masajid, other community, where we are often not working or not operating our institutions with big budgets, right? Where we don't have, we have volunteer imams, right? I'm a volunteer, but still have all of the responsibilities, still put in the 30 to 40 hours a week on top of, you know, my regular job, right? So this impacts us in quite a different way than it does those institutions that have multi-million-dollar budgets for the year. You know, they have endowments. They, you know, they may be looking at laying off folks, but on the other side, we are looking at how do we maintain the services that we've been given? How do you continue to provide and lean on a already taxed volunteer base to even greater extents right now? So the challenges that we're facing, they are often, you see the same type of responses, right? So how do we continue to provide stewardship and services to the external community that is often non-Muslim, but at the same time also respond to the needs of the inner community, right? Because we have, I think we've taken the affirmation and the security that we feel within the walls of the masjid and been content with that. And I think to reiterate what I said earlier is that now we are challenged to realize that contentment, it's not enough. Now, you know, how do we lay the groundwork for effecting real structural and real systemic change that's going to contribute to the health that was not intended for us at the outset?
Thank you so much. We're going to move to questions. We have quite a few questions already. Anyone who would like to ask a question, please go to the Q&A box and just type in your question, and we'll try to get to them. This is a question by an attendee. Assalamu alaikum. How can primarily Arab, American, and Desi communities support Black Muslim communities and not just provide emergency support, but create new pathways of respect and understanding without imposing continuing Black, anti-Black attitudes and environment among Arab and Southeast Asian, as well as communities in America?
Do one of you want to take that first, or should I? I would say first off, with any endeavor, right? There's always a needs assessment, right? And I think those folks that are in those communities, they have the best gauge of what the needs are. So if the support that you're looking to give is in terms of if it's financial support, if it's material support, if it's support in terms of infrastructure, if it's relational support, connecting these communities to resources that can assist, in that rebuilding, in that, in fortifying and building capacity, then I think the number one element has to be a sense of communicating, or not just communicating, but understanding that you are talking to the people who are best situated to deal with the problem. So I think it's the attitude and coming in and not having and forgive the crudeness of this term, but not having an overseer type of a mentality. But of course, that doesn't, does not negate accountability. But often the approaches, they are layered with, or the subtext is there's a power relationship or power dynamic that's often it's often toxic, and it undoes what's intended. So I think at the very outset, I think very clear delineations as to what the resources are, what the problem is, and then having the trust that the folks that you are dealing with have they have the best gauge of what's needed. So I think communication and trust are crucial in beginning that conversation.
So can I add? I would say that from an anti-racism perspective, or even the competencies, like I would actually encourage people to move through those competencies that are required for us to be anti-racist. And so the first one is self-assessment. If you really want to be in solidarity with the black communities, that you have to do that self-assessment of where your knowledge is, where your gaps are, where your biases are, and that's going to be a real assessment. Then the second competency is learning. So that will be listening and learning first before kind of jumping in and assuming help, or even that power dynamic that we may perceive, because there's different resources that people have and how we understand what we're contributing. And so learning how to be in solidarity, which is not just assuming a kind of ally with power and here's a poor, powerless community, but you have a very powerful and resilient community, right, that's been dealing with this for 400 years. And so that's why I brought in that historical perspective, and we're still here, given that people thought that they thought the disease was going to wipe out Black people. And we're still our ancestors made it, and we're still here. So the learning is very important, learning that history, right? Then the third competency, accountability. So we move that first and foremost, which is like the shura and accountability. So that's like the partnership, right? Consultation and being accountable to Black communities. And that looks a certain way if you're seeking solidarity. And then the fourth one is institutionalization. So putting that knowledge, putting those relationships, and putting those into practice. And it's not necessarily saying they're all happening at one stage or at one time, but it all needs to happen really fast. And if you're trying to help and be in partnership, but that lack of learning and not understanding our history and not really respecting or even getting a lay of the land, it's not going to help us in the same way. And so I would agree with everything that Imam Tariq was saying. I just think it's very important that we start to systematize and really implement anti-racism practices when we're doing solidarity actions.
And, if I just could add on to what Imam Tariq and Marguerite is sharing, I would even take a step back and, as a psychologist, wonder about why was that the first question, right? When the sort of the topic of this webinar is understanding the disproportionate impact of COVID-19 on Black Muslim communities. And the first question is, how can perhaps I'm assuming that the questioner was non-Black, how can these communities be in support or in allyship with Black Muslims? When again, and I mean no disrespect, I think the first question should have been, can you tell us a little bit more about the impact of COVID-19 disproportionately on Black Muslims, right? And so while I think those responses by Marguerite and Imam Tariq are necessary conversations that we need to have, it still in some ways centers non-Black people, right? This conversation is about understanding the Black Muslim experience in this moment. And we spent a chunk of time, right, shifting in some ways away from that understanding. And so what I would encourage, right, folks outside of the community, both outside of the Muslim community and those who are Black and not Muslim, is to be more curious about what this experience is. Both is challenges and the strengths that we have to bring to bear in this moment. And so when we're thinking about the rates of poverty, of infection, of death, we also have to think about sort of this centuries-long tradition of resistance, of Black freedom movements, of mutual aid, of being able to sort of cobble together with very little, sort of expected resources, being able to produce movements that have contributed to longstanding structural change. And so I think, I don't want to repeat myself, but I get concerned when the question is first, how can I help, versus what do I need to understand?
Can I just add, like, the historian in me just like popped up, like, so even during that work, so we benefit, right? Like, so if we did that deep historical understanding of what Black people were able to do in, like, not just resistance, but in recreating. So during, like, after the Civil War, when, during, like, when all the the slaves were freed, and at the time when you had all of that mass death happening, because before, medicine was only practiced privately. And so when you had all these people that were freed, and then you had cholera, smallpox, and they call it consumption at the time, like, that was sweeping through, and that you had people that needed medical treatment, the Freedmen bureaus created a system of public health, and today we benefit from that. And so the Black freedom struggle, like, everybody in the society benefits from that. And I think we need to kind of look through that historical moment of, this is what freed Blacks had started, right? To even the education aspect and that public health aspect, and that those systems in place, because we would have just had private doctors going to people's homes, and it would have been a long time coming. And so I think it's very important if we think about solutions right now, and when you look at what people are doing within what they're calling for in the Black Lives Matter movement. And if we say, like, the Freedmen's Bureau was just as revolutionary then as with some of the claims that we may dismiss right now, and it's like, but those are the solutions that we need right now. So I would actually really pay attention to those demands that are being made, because that's what's going to get our society healthy and whole through this pandemic.
So that's a really good segue into this question. Assalamu alaikum. What do you think are the most important concrete steps that need to be taken to reduce the number of COVID-19 infections among Black Muslims?
I think, with that question, I mean, it's a huge question, but I would still go back to, first, if there is an understanding of the sort of structural causes, like the root factors, and then what can I do on a local level? So for instance, in Philadelphia, there's the Black Doctors COVID-19 consortium that, led by a pediatric surgeon named Dr. Alice Stanford. And Philadelphia is a city that has about 200,000 plus Muslims in the area, predominantly African-American or Black Muslims. And so when we think about an initiative like that, it's the partnering with churches as well as masajid in the city, right? And so that when we're thinking about what are the efforts that are already underway that are speaking to the disparities, we have to ensure, and this is why I called on sort of my African-American and my Black brothers and sisters to say, really interrogate whether or not embedded in your efforts is some degree of Christian privilege or Christian hegemony. And so if we're speaking to partnership with churches, we must also speak to partnerships with masajid, with mosques in the area. We don't want to recreate the wheel. We don't want to launch sort of a new effort. And our sort of mission in the National Black Muslim COVID Coalition is to be able to connect all of those activities that are meant to address this moment and ensure that the unique needs of Black Muslims are addressed and are, recognized and highlighted. So for instance, we're talking about the rates of death in the Black community as a result. Many of us who are Black Muslims, we're in interfaith families. I have a Christian grandmother, right? I have Christian family members. And so when we're talking about perhaps the death of a loved one, and only less than 10 people can attend that funeral, and Muslims bury within 3 days. We have to ensure that our Christian family members are aware of the burial practices of Muslims. And so I think those are sort of practical ways that we can begin to think. It really starts with our lens. Is this lens inclusive of the religious diversity? And if it is not, what can I do in order to ensure that it begins to really think about that in an intentional way?
I would add to that. And thank you, Dr. Kameelah. That our faith has to be. Oftentimes, in times of duress, our faith is a coping mechanism. But as I go back to what I iterated earlier, is that faith is also a mechanism for change. So if we're talking about moving the needle in the direction where we are moving away from folks coming into contact with the coronavirus, this COVID-19, then we have to look at proximity, and why are these instances of proximity existent, right? And there are economic factors that are involved with that. There are, and those economic factors determine a social reality, right? You have multi-generational folks living under one house, under one roof, because of their economic situation. And their economic situation is predicated on their, the neighborhood, the social, the education. So it's a multi-layered analysis that's required. There's not one single answer, but if we're looking at, in the interim, then one of the things that could be done, because if we're talking about Black Muslims, we have to look at that intersectionality. We're also talking about the broader Black community as a whole. So if these communities, if you see a higher spike of infection in communities that are lower SES, right? Then we have to look at, so what are the things that we can do to curtail that, their exposure? And one of the things that's been mentioned is like Instacart, right? A lot of folks that have the wherewithal, they're ordering their groceries online. Now, if you happen to be a lower income, income insecure family individual that receives SNAP benefits, any type of federal benefits, they do not allow you to order your groceries online. You have to go out, right? So that's an element of that's systemic, that's structural, right? So these are the types of things that, like, we have to really do a thorough analysis of how we fall victims to the system, and what are the things that we need to push back against. So economics and health and wellness within the communities, themselves, those things that make us more, that position us to be socially predisposed to all those physical factors that compromise the immune system, that make us more likely to be receptive to infection, to disease, to all of these, these negative physical circumstances. These are things that we have to analyze. And though we're having a conversation right now, this is obviously something that within this coalition, we're looking at the broad, the broad scope and the long range activities that are going to be required to bring about that systemic change. The last thing I want to mention, because Sister Margaret mentioned the Freedmen's Bureau, it was so effective, and it brought about change. But what happened when, who was it, Andrew Jackson, or was it Johnson? I always mix them up. But the president, his administration, he snatched the funding from it, right? He snatched the funding from that effort. So all of that structural, the benefit that we got from that change, it was, it's kind of stopped in its tracks to some degree. I mean, not wholesale. So it's not just about moving the needle. It's about keeping it moved and not giving back those gains that we make. So, yeah.
Great. We have so many questions. So what I'm going to do is take 3 at a time and then have the panel respond. all at once. So there's several questions about Ramadan, and I'll just read one of them as kind of an example. Can you talk about Ramadan in isolation and how that will impact the Black Muslim community who are already experiencing the disproportionate impact of this pandemic? So that's one question. Another question that we're getting a few of is, Assalamu alaikum, are there any anti-racist frameworks, studies, and resources that you can provide links to? Obviously there are. Alhamdulillah. I am new to this area of practice and would appreciate any guidance. And then the third is on, do we know numbers of loss in the American Muslim community and in the Black Muslim community specifically? So I thought, Kameelah, you could talk about the survey that that you are working on.
Yes, so I think that's a great question because it also speaks to the mental health and emotional impact. In some ways, I've been plugging this book. It's called The Psychology of Pandemics by Stephen Taylor, who's an Australian psychologist. And he talks about the psychological effects of the pandemic being longer lasting and deeper, perhaps than even the sort of anxiety around infection. And so if we are not aware of the losses that we are experiencing and where, right? So are we losing essential workers? Are we losing elders? Then we need to be able to properly assess that. I would encourage listeners now to go to blackmuslimcoalition.com/loss. We've launched the American Muslim COVID Law Survey in collaboration with the Institute for Social Policy and Understanding, Islamic Society of North America, Muslim ARC, MANA, Muslim Alliance for North America, with many organizations so that we can begin to do that assessment. So what we're asking folks to do, tragically, we are losing members of our community, both in the American Muslim community and specifically within the Black Muslim communities, to tell us what those losses are. We also want to provide grief resources immediately because we know that this is going to be a long recovery effort. And we want to proactively provide the kinds of resources and support information that our communities will need. So again, blackmuslimcoalition.com/loss. We have to sort of understand where our communities are suffering. And the last thing I'll say is, as a reminder, we are in a census year. We're in a presidential election year. And this pandemic is going to have impact for decades. And so we need to now gather the information so that we can position ourselves to advocate effectively for the resources and the necessary tools that we will need to rebuild.
I was going to say really quickly, Briss, I'm so glad that you mentioned the census. If we are having discussions about moving the needle, about really changing the fabric in which we live, changing our reality, then that's really based on assessing where we are in this particular moment. So we'll be living out our the way we illustrate this moment now for the next 10 years. So it's extremely critical. And when I think about Chicago, we've got a 40%, about 44% completion rate. The national average is about 50. Right now. But Chicago, like many of the tracts, the areas where Black folk are living, Black Muslims, sometimes that reporting is as low as 16%, as 12%, right? So, and of course, this also lends itself to another discussion around the digital divide, issues of trust. So I'm also asking that everybody that is in attendance here, not only to fill it out, but to be that person that reaches out to members in your community to make sure that they have filled it out, that we are being counted, because there is so much that is riding on this. I really don't think we fully appreciate the gravity of the situation that we find ourselves in with the 2020 census, as well as the presidential election that's coming up. So thanks for that plug, Dr. Kameelah.
Did we get all of those answered? I kind of
no. There's a couple more. So there's the anti-racist framework, which you can even type answers and if you want to type some links. Yeah. But I'm sorry. Go ahead.
I would say both Muslim Anti-Racism Collaborative, and that's muslimarc.org. We have anti-racism frameworks. We do a lot of programming around anti-racism, and we will continue to do that with, and then also the Black Muslim COVID Coalition, which also it has at its basis an anti-racism framework. And so there's much to be, you could learn a lot in both areas. We do have a lot of curriculum around, for that structural analysis, but also when we think about system change, like for system change work, it's very hard to have like a silver bullet. You have to think about systems are very complex, and to come up with solutions, you have to have a multi-pronged approach. And so what it will take is a deep commitment from all of us when we're in our homes. And I understand that people are really overwhelmed, whether it's like another Zoom call or another meeting, but we will have to gather and we will have to vision and think through how do we rebuild systems, because we know that there were systems that were made to harm particular communities and to either render them not just invisible, either exploit them or through genocide, right? So like even with Native Americans, and we have a lot of overlap within our communities. And I think that's important when we think about the Black Muslim community. When I was doing the work on Standing Rock, there was a lot of Afro-Indigenous Muslims that, and they spoke to their experiences. The other thing that I think that hasn't been talked about, we talked about multi-faith families, but if like with 1/5 of the Muslim population are Black, and it's probably underreported, because when I've talked with a lot of people, like whether, there's people that aren't getting the calls, like they're not just in the system, like whether with their names. And so we don't have the full number of understanding like how many Black Muslims do exist, right? But 1/2 of Black Muslims are converts. And there are ruptures, right? There's social ruptures that do happen. And those actually do render us, and like I'm coming from a convert experience who's, and I'm the only Muslim in my immediate family. And, like even though my daughter's Muslim, but that also, when it comes to care and treatment, like it does impact whether, even with food security as a Muslim, when you have places that are providing not just, not like for those who abide by Zabiha, and you're trying to make those choices to, but burial practices, treatment and care, because there are certain ruptures. If you come from very religious families, right? Like then, there are you don't, like not able to access the networks of support that exist. And it's a very different experience, the convert experience, especially if you're coming from a convert from a marginalized background, a working class background, that experience and access to resources that even exist within kind of predominantly immigrant communities, those aren't easily accessible. So I think for a lot of us, like within the Muslim community, we'll have to do a lot of equity work. And the good thing is like, because we are a smaller community, like there's a lot of hope, like we are actually having much more advanced conversations about race than other multiracial communities. And that we can, begin to address those disparities both within Muslim communities, and then as we deal with it for Muslim communities, to think about what is our role in a broader society. Because for Black Muslims, like we're not just thinking about just Muslims, period. We have families, we have families that are coming from different faith traditions, different backgrounds. And so when we really focus on what's making the vulnerability of Black Muslim life, like particularly pointed where, we can't quite quantify, but we still do know, whether it's like in the prison system, like I know there's people, like we have not talked about homelessness, but I've known people that when they, for iftar during Ramadan, when they got the list of Black elders who needed food. And so this is a story I heard from Atra Flemons, who made a call to LA County, to the city council, where they wanted to reach elders who needed food. And when they got the list, a significant portion of those lists were unhoused. And so it was, how do we start to advocate to get them back in homes? And so those are the kind of issues when you do center, vulnerable communities, you come up with better solutions, because those are the people, like most likely to go to the masjid anyways, because where are they going to get their meals during Ramadan? That was the one time, you know, for this particular community to get meals. And so we have to start to center them as we think about our public health solutions.
And I want to add something really quickly to that. So I'm the director of civic engagement and interfaith services for CIOGC. So it's one of the anchor organizations, and I think one of the older ones of its kind as an umbrella organization in the United States. And I think this is also where for organizations that are situated similarly, where they can take the lead in facilitating these conversations, even going back to the very first question that was asked about how do we assist? Well, you know, in reframing the question, or I guess the impetus for that question, you know, instead of it being how do we assist, but tell us about you, let us know, give us the real lay of the land, help us to understand and appreciate your experiences, and to really foster these relationships between a diverse community that at times, and I think the Black Muslim Coalition is a representation of that, a time that needs targeted approaches that can be laser focused, right? So I think that our umbrella organizations have a tremendously important role to play in supporting those efforts, these specific efforts, but also in facilitating open conversations to really have those conversations that we often don't want to have, right? I mean, of course, we're about to come up on Ramadan, and who wants to argue during Ramadan, right? But but the reality is we are going to be in contention with our own selves. So this is also an opportunity for us to really look at purifying ourselves of those things that maybe we have not dealt with or recognized that have impacted the overall health of the community, right? Because if one of us is not healthy, none of us are healthy. So I think that's my call out to our umbrella organizations. If you're doing the work already, alhamdulillah, keep it up. If not, consider it as a part of the something that you should take on, inshallah.
Do you want to say more about Ramadan specifically? There were several questions about how Ramadan will impact people who are already being negatively impacted by COVID-19.
Actually, I think that this is a healing mercy. The timing of it, in that Ramadan, it does allow us to step back. We find out we can do less with more, which is for some of us, that's nothing new, right? But it really does allow us to detach to some degree and to find a sense of centeredness. I mean, of course, there are a lot of medical benefits to fasting, and of course, I'm not about to try to throw them all out there. But if you're able to, you will find benefit in it. Just the reflection, just the spiritual and the emotional, the mental space that it puts us in. I think it allows us to deal with the stress of this time, to put it in perspective, and to deal with it in a more productive way, to find the good in it, right? Which is difficult outside of this time. So if there's one message that I would give to folks, you know, as we're coming up into this blessed month, is to allow this to be an opportunity for you to find the good, to recognize Allah's mercy, and to let this be a comfort during a really difficult time. So I know that sounds very, very general, but that's all I got for you right now. So.
Dalia, if I may, I know we're getting to the close of the hour, but I did want to take a minute to specifically address Black Muslims who are watching. Embedded in our framework for the National Black Muslim COVID Coalition is the psychological framework of radical healing. And it really sort of captures a spirit of what's called like this dialectic of acknowledging the oppression that we have experienced, right? while we're also tapping into how these moments of crisis and of turmoil, of upheaval, have also been very generative, that it has allowed us to really exercise, this rich creativity, ingenuity, being able to reimagine what we believe and think about ourselves. And this is a moment, Brother Kenny Gamble, Lukman Abdul Haq, he told me, he said, this is actually a moment to rejoice. And I was like, you got to explain, because you're an elder, so I'm going to take in what you're saying. And he said, this is a moment to rejoice because we have been through so much already. And we have, taken in that wisdom and those lessons. We have been patient and appreciative of, sort of the lessons that have been gained through those experiences, and we need to apply them now. So for when we talk about sort of the Black experience or the Black Muslim experience, sometimes we lead with the statistics, the data, the disparities, and that is important. But I think it's also equally important for us to be reminded of our strength, of our intellect, of the wisdom that we have gained through our experiences, and apply them now. So this is a time for radical healing, radical reflection, of reimagining the possibilities. And perhaps, being able to say that this pandemic offered us an opportunity to lead our communities, right, both the African-American and American Muslim community, in a way that was thoughtful, that was intentional, that was passionate, that was inclusive. And we can sort of as Imam Tariq began, we can be the custodians for that future that we are fighting for.
Very well put. I'm going to actually close us off now and just have each of you do closing remarks. One thing for the audience to take away from this great webinar. Marguerite, let's start with you.
Yeah, well, I would really build off of what Dr. Kameelah was saying, is that this is a moment, right, of Black Muslim leadership and Black Muslim vision during this time. And so it'll be very important for those who seek solidarity, who want to include, to be, who also draw on the legacies that we've helped build, from the civil rights to the Black freedom movements, to respect that leadership. So we hope that we're inviting people to join us as partners in this work. And it is definitely a historic time. We're doing really amazing visioning as we're kind of bringing together local, regional, national Black Muslim groups and lifting up multiple voices. And for me, that gives me a lot of hope. And this Ramadan, to see people across the country that normally I only see during convenings, and that we're doing a lot more storytelling. And so we hope that people will join us in that, like in these spaces. And this is a time through struggle. It's definitely a beautiful struggle to be part of, and it's definitely an honor to be here and to witness, to bear witness to the solutions, to the type of merciful actions that our communities are doing.
Thank you, Marjorie. Dr. Kameelah?
I would just kind of emphasize again that in the midst of this despair, and as someone who is a mental health professional, what sort of concerns me the most and keeps me up at night is knowing that we have not fully been able to sort of process what this moment is and what it will require, the losses that we will have to grieve. And this is through the summer and perhaps through the fall, if not longer than that. So I would say for, to Black Muslims specifically, to begin to, as a family, to sit down and capture the stories and the narratives and the experiences of the elders, but also of the children, right? Asking them, how are you feeling in this moment? How can I be, a parent that is paying attention to the thoughts and the feelings that this is bringing up for you? I think it's a moment for us to go back to what has been always a foundation, which is our faith, which is our cultural identity, it's pride in who we are, and to leverage all of those things for this particular moment in a way that is inspiring, not just for other Black Muslims, but for the country. I think it's possible for us to do this. So I would say be encouraged. I would say be patient and self-compassionate towards yourself. And I would say be curious about others, because the moments that we're in now are the only moments we have, right? We are not guaranteed anything else. And so to be intentional about the connections that we try to foster, particularly now.
Thank you so much. Imam Tariq.
I would say, first off, a mentor of mine, he says that the quality of your life is determined by the quality of the questions that you ask. And in this time, I'm inviting us all to ask the question, two questions. First is not just why is this happening, right? But what is my faith inspiring me to do, right? What is my faith inspiring me to do? And I would invite us all to think about ways that we can really see Allah's mercy, right? Because our worth is not defined, or it's not displayed in times of ease. Our worth, our value is determined, is shown in times of difficulty and duress. So we can thank Allah for giving us an opportunity to show how valuable we really are, to show, you know, what we're made up of as individuals, but also what our collective capacity, what that is. So there's a lot of benefit that we can pull out of this, right? The nutrition is the most, it's in the marrow of the bone, right? So you get down to it, it's deep inside. So I just want to remind everyone that we've been given a difficult situation, but we've been given it so that there could be an outcome that we could, inshallah, be proud of, that we could be pleased with, knowing that we responded in a way that showed the best of who we are, not even as a specific ethnic group or racial group, but the best of who we are as human beings, right? As stewards, as a Khalifa. So with that, I pray that this has been beneficial. It's been an honor to talk with you and to listen and learn. And I pray that we go into Ramadan really looking for that mercy and looking for that strength and ready to do some work and assist and ally and make some real change, inshallah.
Thank you. Thank you so much for sharing your wisdom and your expertise. I think everyone on this webinar learned a lot today. I want to just close out by saying Ramadan Kareem, stay safe, and you can learn more by going to blackmuslimcovidcoalition.com and ispu.org. Assalamu alaikum.
Wa alaikum assalam.